Thanks so much for staying with us and welcome back from that short break. Welcome to the Twitter Jabs too. My name is Aggie Owase and we are continuing the conversation on Breast Cancer Awareness Month that commenced on the 1st of October and will be coming to an end on the 31st of October. Joining me at the center of this conversation to give us more insight, like I mentioned earlier, is Dr. Samuel Mukasa, an obstetrician, yes, and gynecologist, head of health, Kira Municipality Council. Good morning, doctor.
Good morning.
Thanks so much for joining us this morning.
You're welcome.
So it's Breast Cancer Awareness Month. Yeah. Let's start with probably the most obvious question. What causes breast cancer?
Okay. So there are so many causes of breast cancer, but most importantly, we'll go along the risk factors. Mm-hmm. So if you are a woman, you are at a higher risk of getting breast cancer because more women are recorded to have breast cancer than men. If you start your periods a little earlier than usual, you have a higher risk of getting breast cancer. If you take long going into your menopause, you have a higher risk of getting breast cancer. If you take long before you have your first child, you have a higher risk of getting breast cancer. If you drink alcohol and if you don't exercise well, you have a higher risk of getting breast cancer. And if you have a previous history of either breast cancer or constant breast conditions, you have a higher risk of breast cancer. So cancer comes as a result of abnormal multiplication of cells in the breast tissue. And as a result, your breast changes shape and it can grow out of proportion to eat you up and end up into death.
Before we get into the preventative measures of breast cancer, you mentioned a few things that caught my attention, and one of them is when you delay to go into your menstrual periods. Yes, that is something they told us back in the day that it was something that's normal for everyone. And also the other one is when you delay to have children. So how does it really come into play?
For correction, it is the earlier one is actually corrected. You got it a bit wrong.
Twisted.
If you have your periods a little earlier, like for girls who go into periods at 8 years, 9 years, you have a higher risk of getting breast cancer. And if you take long without conceiving, you have a higher risk of getting breast cancer. We know that the anatomy of a lady, you are ready to conceive children. Some people as early as 10 years, but averagely within your 20s you should be conceiving. So there are ladies, because of career reasons, they go into their 30s before they have concentrated on raising a family or having children, and the more you take before you have your first child, the higher the risk of getting breast cancer.
Is it for the fact that, of course, when you have children, you are expected to breastfeed the children? Is it for that reason?
Yes. When you have children, your body, part of your body is given different activities, including your breast. So when you conceive and you bear your child and you breastfeed, the breast tissue goes through different modifications and activities, and in the process, the risk of getting breast cancer is reduced. Yes.
And how about women who opt not to breastfeed?
For women who opt not to breastfeed, the risk still remains high because but the mere fact of you having your first child, the expectation is majority will have to breastfeed and they'll have to put to use the breast which was given to them by God. Yes.
Okay, now let's talk about some of the preventive measures of breast cancer.
Critically, for prevention, you need to be on the lookout. Ladies and gentlemen are advised to be on the lookout to do self-examination to ensure that they can assess themselves, do a breast exam. And breast exam doesn't really mean just touching, but you observe the shape, the size, and also the texture of the skin of the breast. If you are a lady and when you're bathing or when you're doing a personal examination, you find a lump or a ball inside your breast, just know that you need to go and consult your doctor to do a thorough checkup. Another thing is physical activity. Ladies and gentlemen are advised to spend a number of days, at least 3 in a week, doing physical exercises. routinely and ensure that they burn those extra calories. Some of the extra calories that we take in and we don't burn out end up being converted into fats, and in the process, because the breast is one of the fatty tissues, they can easily go into the breast and they ensue cancer. Now, another thing is to minimize, if you can't avoid, the bottle. Minimize alcohol and also cigarettes. Cigarette smoking and alcohol, heavy drinking of alcohol, are higher risk to breast cancer. The other one is you need to, in case you need to routinely visit the doctor and do these thorough body checkups, including the physical examination, which includes also the breast, at least twice a year, to ensure that you are in good shape, and in case of anything, you are in position to detect it early and get a solution.
Yes, and earlier you talked about both men and women, and it's actually true that breast cancer for men is usually very much disregarded or downplayed, I should say that, and not so many men even focus on that. So how can it be detected? Because for women, you've said you have to, check your breasts and see if there are lumps. For men, because, I mean, you wouldn't detect a lump, would you?
Okay, both men and women have breasts.
Yeah.
It's just the difference in size and texture. So some men have gynecomastia. It's a condition where their breast tissue is a bit bigger than normal, and some, majority of course, don't. But men have a problem. Even when they have a health challenge, they rarely seek attention. So even men need to be proactive in assessing their body parts, including the breast. And in case they see that there are changes in either texture, how the breast looks, if it starts growing bigger, either sides or just one side, or there are changes on the skin, and when they touch, they find there's something inside the breast, they need to go ahead and check in with the doctor.
With the doctor.
It is true that cancer affects more women than men, but the truth is there are many men that register cancer at the institute.
Yes.
Yes, and many come late, and when it's a bit advanced, and they cannot get good care. So in case you detect it early, there is treatment. They can remove the breast. There is chemotherapy, and if you get attention early, you can get cured of cancer.
And speaking of the lumps, especially for the little ladies out there in school, during the stage of puberty, that's when your breast development comes into play, and there's usually lumps. So how can it be differentiated, from the usual lump of puberty and the lump that comes with breast cancer? The usual lump of puberty grows at a moderate stage and they are uniform, compared to the lump of breast cancer, which develops most cases in one side, and it causes an abnormal shape of the breast, and many times it will come with pain. It begins painless, but with the time the breast will change shape, will change size, and it will be unilateral. It is rare that the cancer comes in at the same time. So for the normal growth, irrespective of the age and size, the breasts will be similar. But for cancer, it will start with one side in most cases, and it will be rapidly growing. And of course, that should alarm the victim to seek medical attention. Okay, now besides the lump, what are some other vivid signs and symptoms of breast cancer?
Okay, so the lump is what you feel when you palpate or when you examine, but there are other signs that come. If you find that there are scales coming on your breast, if your skin starts becoming shining, and compared to the contralateral or the other side of the breast, and that side is a bit shining, if it develops scales, if it develops a skin which is like an orange skin texture, where that side of the breast looks like the orange texture, there's a higher likelihood it's cancer. If the nipple draws or retracts inwards, there's a higher likelihood that is cancer. Yeah.
Let's talk about breast cancer treatment in Uganda. How accessible is it? Because statistics have shown that 80% of women who are diagnosed with breast cancer usually go to the health center or the Uganda Breast Cancer Institute at a time when breast cancer is in the final stages, and usually 3 to 4 women usually end up dying because they cannot get that treatment, or the treatment cannot help.
So the greatest challenge you have in Uganda healthcare, especially when it comes to NCDs like cancers, the non-communicable diseases like cancers, is awareness. Most people are not empowered with information, and they don't have a habit of checking in with doctors. Most of us only go to see a doctor when you're actually sick, but it should be a routine to go in and check in with the doctor. So the challenge we find as doctors is that majority of the patients who have cancer actually present late. Now, with the current trend of self-medication, signs and symptoms will be presenting with someone, but they will take a lot of time to go and seek professional care. When they have a little pain, or even the lump itself, it will either be ignored if it's just the texture or the changes in the skin texture, which are alarming to a doctor, but because someone is not empowered with the information, will ignore. Then until a big lump is faced, and most times it's either bleeding or there is pain, that is when someone will come to the doctor. So there is access to treatment, but the only challenge is that majority of the people who present to the Cancer Institute actually present in advanced stages. So the treatment is there. You have health professionals, doctors who are ready to serve, and they are doing a great job for Ugandans. But the challenge is, thanks to the Pink Month, we need to do more awareness, we need to be more vigilant, and we need to ensure that people are empowered with information to be on the lookout for their health, and ensure that in case of early signs of cancer, they're in position to actually suspect and seek medical attention.
Yeah.
Yes.
And let's talk about, because you've said the Pink Month, which is the month of October. What are some of the importances of, the Breast Cancer Awareness Month? For the viewer out there.
Yes, for the viewer out there, the most important, the reason why this month is very important is because it's a gap that has been documented, that the reason why most people get severe effects and even death as a result of cancer is because they are not empowered with information. So we use this month to do more awareness, to do more advocacy, and even currently Chira municipality with the Aita charity, we are preparing a 2 days camp, comprehensive medical camp in Chira, to ensure that we give access to these services, the health professionals that are ready to serve. So the person out there needs to know that cancer is serious. Slowly by slowly, it's eating our population, and everyone is at risk, whether men or women. They need to be empowered with more information. Most importantly, if they suspect any signs or symptoms, they need to seek medical attention. And we need also to fight against self-medication. Many people, with so many people out there, they seek medical attention from non-professionals, and they stick to it. And in the end, after things are beyond repair, that's when they seek attention, and that is when we get them at the Cancer Institute.
Yes.
And that is the reason why majority of them present late. However, part of the treatment is removing the breast. If you are a woman who is not in need of a breast, or a man, and there is history of your family having cancer, or one of your relatives, or you having had cancer previously, you may need to visit a doctor or come to the institute, and they have the breast removed. Once it is removed, the risk of a cancer in the breast will also be eliminated.
But let's go back to the case of awareness, because it looks like most of the awareness is done in the urban centers in Kampala and cities and towns rather. But there's people deep down in the village, and actually statistics do show that some of them do succumb to cancer even when they have no idea. Back in the villages, there is no awareness, there is no access to treatment, and even there's checkups, because there's only one Uganda Cancer Institute. And people from, as talking about Kanungu the other day is like stuck in my head, but that is an example of people who live deep down in those remote areas who actually cannot have access to these services. What can be done about that?
With our health system in Uganda, the leadership is at the Minister of Health, but they are regional hospitals, district hospitals, and health centers. In those health centers, they are health professionals who are in position to assist in providing services regarding breast cancer. So I would implore everyone in the villages to, first of all, there should be a deliberate move to increase awareness by the government and other implementing partners.
Yes.
But critically, people need to know that these services are actually available at their doorstep, in the health centers nearby them that are public. These health professions in those health centers are in position to assist and in being positioned to actually refer for cases that may need services of the National Institute. The National Cancer Institute is designed to manage the referred cases, but the problem is that majority of the cases wait until they are in the critical stages for them now to come to the Cancer Institute. So I think there is more gap in awareness and people taking deliberate efforts to be in charge of their health than the challenge of having one Cancer Institute. At all district levels, sub-county levels, the health centers and VHTs need to be empowered with more information. There's need to disseminate more information in the villages using the VHTs, and also encouraging the communities to routinely visit the health centers that are near to them to ensure that they can access these services. And for those that need the services of the senior specialists that are at the Cancer Institute, they will access them. And it will also help reduce on the burden of that we are facing at the Institute, because of the challenge that people are not aware. Many succumb to cancer, and for those that manage to come, they come in the advanced stages of the cancer.
Yes, it's very much unfortunate. But let's talk, according to statistics, what's the prevalence rate of breast cancer, and also what ages are affected the most?
The prevalence of the cancer is affecting more women than men, and advanced stages between from 30 upwards. The majority of the cases are in beyond 30 years of age. The current statistics, I don't have it off head currently.
Okay.
Yes.
Oh, you've already told us about the prevalence rate, so that's fine. But moving on now, what are some of the effective remedies that one can employ, or people out there, to prevent breast cancer?
One, they need to minimize on the alcohol and cigarette taking, smoking. They need to be more active. They need to ensure that they do physical activity increases. Then those that have a history of cancer, they need to be more proactive. They need to do physical examination. Self-examination is very critical, because most of the trivial signs and symptoms can be detected far earlier before the cancer becomes a big problem. But without self-awareness, without taking the steps to examine themselves, they always miss it, and it always goes to the doctors when it's already advanced stages.
Now, yes, we do know that breast cancer is one of the commonest cancers that is affecting not just Uganda but the entire world. But what are those other cancers that the people need to watch out for?
Especially in women of reproductive age, cervical cancer is still a big cancer. Cancer of the cervix is affecting us a lot, and many women are succumbing to it. Whereas it is known that there is already a vaccine against cervical cancer for our 10-year-olds. Let's ensure that our girls, 10 years to 13 years, go and get the cervical cancer vaccine. Another cancer that is affecting the population is lung cancer, because of the heavy smoking, and liver cancer, still related to heavy drinking. Then mental health is another non-communicable disease that is affecting many people at different levels. So we need also to be aware of mental health challenges, especially in the urban setup. Many people think are safe, but we are all at risk of mental health breakdown.
Yes, absolutely.
Yes, so
I agree.
I encourage people out there to ensure that they are on the lookout for ladies, cervical cancer, amidst breast cancer. Then mental health is also a big challenge, and also to ensure that people access other sexual and reproductive health services that are available in their communities, including family planning, contraceptives, and people who have miscarriage to have post-abortion care.
Yes. Now let's talk about the treatment as well as checkups. Just to be clear for someone out there, because I know so many people are worried. These economic times are not the easiest. So are these checkups free of charge? How about the treatment? Is it affordable?
First, the checkups are free of charge, especially at our public health facilities. And the treatment, depending on the stages, Some actually free of charge in our public health facilities, and some, if you go to Cancer Institute, for the services that can be offered at the Cancer Institute, everything is free of charge. Now, for services, let's say medicines that cannot be afforded, that are not catered for at the Cancer Institute, they will ask you to go and buy them. So, amidst the economic crisis, I would say that public health facilities have a range of free health services that they can provide to our communities.
Yes.
Yes.
And as Kira municipality, are there any special activities that you have, put in place to commemorate the Breast Cancer Awareness Month?
In partnership with other implementers, including AITA Charity, Nakasero Blood Bank, Maristops, we are organizing 2 days medical camp, comprehensive medical camp in Chira municipality, and we shall have a wide spectrum of free health services, including examination of cervical cancer, examination of breast cancer, information and comprehensive information on breast cancer, and advocacy for breast cancer awareness and cervical cancer. We shall provide a screening for HIV. We shall provide family planning services. We are going to provide treatment for common infections, especially for people who are sick with, let's say, fever. There's already treatment for that. We shall be screening for hypertension, people with blood pressure. We shall also be screening for people with lipid disorders.
Yes.
And sickle cell.
Oh yeah, so I think there's need for everyone out there to
we implore everyone out there, especially in the areas of Chira municipality, to come and be part of this event.
Absolutely. I hope that Priva Elibas has had that, including myself. I think I'll come and be part of it. But as we wind up the conversation, give us your final remarks.
My final remarks is to encourage everyone out there, to be aware of this cancer called breast cancer. Breast cancer is serious. It's taking our mothers, our daughters, our sisters. So let's be more proactive in taking care of and in checking ourselves, in taking good care of our health, because a healthy body gives you houses a healthy mind and gives you the opportunity to live longer. Absolutely. Everyone is interested in living longer. And for the event this Saturday and Sunday, we are calling out everyone out there to come and be part of this free comprehensive medical camp in Chira municipality.
Yes, well, there you have it from Dr. Samuel Mukasa. Thank you so much for joining us this morning. I couldn't say anything more. He has literally, said everything in regard to Breast Cancer Awareness Month and called upon everyone to be part of all these, awareness campaigns that are going on in Uganda. He mentioned one in Kira municipality, but I know there's quite a number that's still coming on board. So yes, be part of them. Go for that screening, go for that checkup. It's very important for you. And for the men out there, the gentlemen out there, this is not just for ladies. This is for you as well. Well, I've been joined by Dr. Samuel Mukasa, an obstetrician and gynecologist, head of health, Kira Municipality Council. And we've been tackling the issue of Breast Cancer Awareness Month, which is this month of October. Coming up is our views. This is Sunrise at Sea. Don't blink.